ACT police have vowed to work closer with mental health authorities after a fatal shooting last year. A coroner said police did nothing wrong when they shot the mentally ill man, although she recommended some changes. Health authorities say a lot has improved since the shooting, but some advocate groups aren't convinced.
It's a tragic story illustrating the complexities of mental illness and the law. Last year, Nathan Doherty was shot dead as he lunged at police with a knife and meat cleaver. The 27-year-old suffered a mental illness for most of his life. The coroner found he brought his death upon himself by his own erratic actions. And while the officer who pulled the trigger has been cleared of any wrongdoing, flaws have been exposed in the way mental health services and police had worked together.
The coroner's findings yesterday, and indeed her recommendations, are significant, and ACT policing will be reviewing those very carefully, very closely.
One of the key issues rising from the inquest centred on the way information was shared between mental health workers and police. The coroner's recommended specific protocol be developed.
There are provisions under various acts which allow for police and mental health workers to share information. No specific protocol at the moment. That's something that we will examine.
For too long, agencies have remained, the common word is siloed, and information is not adequately shared.
But the Territory's top mental health expert says a lot's changed in the last 18 months.
We've been able to have a better sense of understanding of what the police need in terms of mental health information.
The coroner's also recommending the extension of a trial where a mental health officer has been embedded in police operations. Since its launch a year ago, clinicians have helped in more than 1,400 cases. Police now want the service expanded.
Its extension to more days of the week is currently under active consideration.
Perhaps preventing a repeat of the tragedy. Jessica Nairn, ABC News, Canberra.